Sometimes you would have joined nursing for a service. You want to serve people, to serve the community and sufferings. I've heard many students saying like there was a death in their family. During the death, like some nurses would have helped seeing their love. They felt like they would have been future nurses. And some people like it would have been their aim to serve the community. So you would have come with lots and lots of dreams, okay. So nursing is not just a simple task of work, okay. It is not just an occupation, it is not just a work to fetch you money, okay. It is something which is more than that, okay. Like which is more than what are you going, like you will be getting salary. Salary is the secondary thing. More than that salary, you will be self-satisfied. You have that happiness. You have that worthfulness when you complete your work, okay. So once you finish your job and you go in for sleep, and that night you feel that my day was worthful. I have treated somebody, like I have treated someone and they are benefiting from me. So something like you feel that you are worthful. You feel that like you are blessed. Somebody coming and telling you, okay, sister, like you are an angel, you saved my son. Okay, those words make you more positive. That will remain in you, okay. So more than your occupation and more than just a work, nursing is a service, okay. So instead of this service, how do you categorize nursing as a profession? Okay, nursing as a profession, the term only says it is a profession. Nursing definitely is a profession, okay. So there are some like requirements to make a work into a profession, okay. So we will discuss the characters which make that nursing into a profession, okay. So the first point is specialized education, okay. So you have a specialized education for nursing. So in one of our class we have already discussed that we have the diploma course, degree course, masters, advanced, extended, and all those things we have discussed, okay. So you have a specialty education area. There is a syllabus formulated for nursing. There is a requirement for nursing, okay. So when you take your 4 years of BSc nursing or your 3 years of diploma nursing, you have your formulated syllabus. You have these many numbers of subjects, you have these many numbers of clinical hours, you have these many hours of theory hours, and like community hours. Everything is formulated and the students are supposed to meet that requirements. You have a thing called as your logbook, your procedure manuals, you have your records. All these things are maintained during your studying period, which shows, which is an evidence that you are having an systemic way of learning. It is not just learning, it is a systemic, a behavioral learning what you are doing in this area of studying, okay. So that is your specialized area of education is present for nursing, which is giving an evidence that nursing is a profession. And then we have the next area of body of knowledge, okay. Body of knowledge, we say it is, you don't do anything without a rationale, okay. So in future classes we will be discussing about the nursing care plan, the nursing service, the planning, the implementation. You have lots and lots of things in nursing to be done, okay, and everything in nursing is validated with your rationale, okay. You don't do anything without a rationale. You carry a pen with a rationale, you carry a syringe with a rationale, you remove a needle with a rationale. Everything is rationalized. You know for what you are doing this, okay, and when you have a reason for doing, it is right. Okay, you must have a reason why you do this, okay, then definitely that is right. There is no such thing as this is the way you have to do. When you do this, you have to protect the patient, the patient has to be saved, the patient has to be benefited, then it is rationalized. Okay, so that is your body of knowledge. So you must have a basic knowledge when you are practicing something. Okay, so before your clinicals or your teaching, you will have a heavy body of knowledge, like you will have knowledge from different areas. Okay, you don't only study your specialty areas of your pediatrics, medical surgical, midwifery, on all those things, but also you learn different other subjects as your anatomy, physiology, biochemistry, psychology, sociology, and like nursing research, and like so many things are coming in between, which is giving you an adequate source of knowledge to help you practice in the clinical area to protect the patients. Okay, so you are having a strong body of knowledge, which shows that nursing is a profession, definitely. Okay, and then we have service orientation. As I already said, nursing is not an occupation, it is not a work, it is a service. Okay, you get payment for that, but you don't work only for that. Okay, so like whatever it is, like many people say you have entered nursing just to earn money, you want to go abroad, just because of that you have joined. But whatever it is not, there is always a point behind that. You want to serve the society, so whatever action you do, your service stays behind. Okay, so because of that service orientation, nursing is called as a profession. Okay, so nursing is definitely a profession because you have service behind your salary. Okay, so you don't work only for salary, you also work for your self satisfaction. So because of that, nursing is a profession, definitely. And then we have altruism. What is altruism? It is the selfless concern for others. Okay, just remember, I think now I am shooting this video. Maybe in future, after like 5 years, after 5 years when you see this video, I don't know how many of you will remember this COVID, but people definitely they would have experienced a pandemic, so that would have been a history. Okay, so this word of selfless service, selfless concern for others, definitely it is applicable for nursing. Okay, so it is particularly applicable to our medical and the nursing team, because like during this COVID, the whole world, okay, was inside the house. Only we people were working. Okay, only the doctors and the medical team was working. We know that we are under risk. Okay, but even then we worked. Okay, even then that kit was irritating, that PPE kit irritates, you can't breathe, that mask, that N95, it makes you suffocate, but even then you worked. It is all like nursing professions, like the nursing people with great lot of service, they worked. Okay, so it is only we people who are inside, they can understand that pain. Even in that pain we worked. It is because of our altruism, our selfless concern for others. We know that once if I take care of that patient, I will become positive. Even then I work, I serve people. Why do I do so? It is because of this selfless concern for others. Okay, it doesn't happen in any other profession, any other occupation, only in our medicine and nursing it happens. So this is one major example, like where we have altruism in our profession, and definitely nursing is a profession. Okay, so then we have ongoing researches. So what is this ongoing researches? Okay, see, around 1990s, like we started this research in an active mode. Okay, so it is like nursing research became very popular from these 1990s, like where research evidences plays a major role. Okay, so wherever you go, you put an IV line, you have to have a research evidence, like why do you start with this area, okay, why do you wipe from this area to this area, why do you insert from this area to this area. So you have like research findings which supports your action, okay. So researches are always ongoing in nursing, okay. There are people continuously doing researches on aspects like where there is a need for more effective nursing care to be provided, where nurses can be more effective in implementing care for the patient, where nurses can save the society to promote the health of the patients, okay. All these things need ongoing researches, and we do conduct researches constantly in the clinical areas as well as in the teaching areas, which is going to help benefit the societies, okay. So definitely nursing is a part of profession. So next is the code of ethics. So what is code of ethics? It is the rules and regulations, or it is the formulated set of behavior what has to be followed during the working area, okay. So we have code of ethics formulated, we have a systemic, we have a formulated set of behaviors, okay. So this is the way you have to walk, this is the way you have to dress, you have to take care of patients in this way, during giving medications, these are the sets of rules and regulations to be followed. All these things, you have a big set of rules and regulations, or the code of ethics, that is to be followed in nursing profession, again which is denoting that nursing is definitely a profession. And then finally coming to autonomy. What is autonomy? Autonomy is the independence of practicing, okay. So your independence of practicing in the area wherever you are employed, okay. So nursing is having a restricted amount of autonomy, we can say, because like we are not an autonomous person to give many lot of drugs, okay. You have restriction in giving drugs, but you have many things where you can do it with autonomy, okay. So you can give, even a list of drugs can be prescribed by nurses, okay. So there is a list of drugs that one day we will discuss in separate class. So autonomy is present in our profession. You have the full rights to claim, you have full rights to take care of patient in the areas, okay. So again showing nursing is a profession. And then finally we land up with professional organization, where we have lots and lots of organizations which is supporting the nursing professions, okay. You have organizations which give list of like principles, like the protocols, all these things which is giving us a standard behavior in the areas of working, okay. So you have the American Nurses Association, the Indian Nursing Association, the International Nursing Association, and like Tamil Nadu Nursing Council and Midwife. So you have lots and lots of associations, okay. So these associations, they give or they formulate sets of rules and regulations, or protocols, standardized behaviors, like the syllabus, the patterns of working, the procedure manuals, all these things these organizations provide us. So which is again showing that nursing is a profession. So you have lots and lots of evidence that nursing is a profession, and you can definitely claim it is a profession, okay. So when you get this question as like state why nursing is a profession, you have a solid answer, you can write all these things, okay. So you have the specialized education, the body of knowledge, the service orientation, altruism, ongoing research, code of ethics, autonomy, and the professional organization, which is going to provide an evidence that nursing is a profession, okay. So hope this class you understood. In case of any doubts, or if you want any particular topics, kindly go and give your comments in the comment box, okay. Until the next video, see you, bye.